Hello, this is Sarah Vanchevsky, the Data and Analytics Manager at CPCQC. And if you are a user who is now entering data for Dyadic, this is an orientation to how you will enter data for Turning the Tide Dyadic. So under My Projects, if you've been doing Turning the Tide in the past, you're going to see these two Turning the Tide projects, the hospital level data and the readiness assessment, and the Turning the Tide patient level data. What's new that you'll see if you're now participating in Chosen Dyadic is this project, CPCQC Chosen Dyadic. So one thing will remain the same, which is that every month you will still be filling in data for the Turning the Tide hospital level data form. So we're still going to be asking you to submit information about how many patients were admitted to your hospital, how many of them were screened for substance use, and how many screened positive. And then that information also disaggregated by race, ethnicity, and payer. So that's going to remain the same. What's different is that instead of entering data here in this patient level data form, you're now going to be putting that information, basically that same exact information about the mother, into Chosen Dyadic, along with the corresponding infant information. And so the way that this looks is that you'll come in here and there's going to be both this maternal data and infant data for you to fill in. So when you go to add a new record, we can ignore this for now. This maternal data here is basically replacing that old Turning the Tide patient level data. And the way it's set up here in this project is each maternal record is linked to an infant record and they're connected. So we can see both the mother's data and the infant's data. So let's start here with the maternal data. This is going to look very similar to the Turning the Tide patient level data form. So you'll complete one of these forms for each birthing person who was admitted for a live or non-live birth and screened positive for substance use during pregnancy using a validated tool or is currently prescribed medications for opioid use disorder. We do not complete this form if the birth parent's only substance use was cannabis and or nicotine. So we can confirm the patient meets this criteria, and then we can go ahead and enter this information here, the date that this was submitted, as well as the substances used during pregnancy. And just note that if the patient is in fact only using cannabis and or nicotine, then we aren't going to see follow-up questions. It's basically just going to take us to the end of this form. But if they're using another one of the substances, for example, opioids, we're going to see more information to fill in about this patient. Their date of delivery, the birth parent age, the gestational age, the birth parent's self-reported race, selecting all that apply, and note that you can select not documented or unknown, or patient declined or refused. You'll note that there's these must provide value indicators, and that basically indicates that this is a required response. And in order to be considered complete data, we need to respond to each of these. Their ethnicity, their primary insurance, the birth parent's primary language, the number of newborns, noting that if it is twins or more, please fill out a separate form for each infant, extenuating patient-specific circumstances. Was a plan of safe care developed for the dyad? And then clinical care provided to the patient. And again, these should look very similar to what you're used to in the Turning the Tide patient level form. Did they receive counseling on recovery treatment services? Were they referred to recovery treatment services? Was recovery treatment medication initiated during birth admission? Did they receive a consultation with social work or case management? Did they receive naloxone in hand before hospital discharge? Was a postpartum visit scheduled? Was an antenatal consult done prior to birth? Anytime during pregnancy with pediatrics, neonatology, or family medicine? Was toxicology testing performed on the birthing person or mother? And then finally, this section here only shows up for patients who are using opioids or MOUD, and we can indicate whether the patient was counseled on medication for opioid use disorder, received MOUD prenatally or during the birth admission, was referred to an outpatient MOUD treatment provider, was discharged with a prescription to continue MOUD after discharge, or none of the above. Finally, you can enter some optional notes here. A reminder that a separate form is required for each patient. When we're done with this form, we can select complete. And to enter data for additional birthing patients, we can save and exit form and submit a new form. To submit the corresponding infant form, if you click Save and go to Next Form, it's going to bring you to the infant form. We are getting a warning about some of the fields being required that we did not fill in. So these are the fields we did not fill in, and it wants us to provide a value. So we can say, okay, that'll take us back to the form and we can complete those. We can ignore the warning and go to the next form, but I do recommend heeding this warning and making sure that all this data is filled in so that you have a complete record. Just for now, just to demonstrate what the infant form looks like, I will ignore this and go to the next form. And now we are looking at the infant data that corresponds to this record. So here we're just entering the record ID. It should be the same as the maternal one. And this is that linkage between maternal and infant data. Again, we'll put in the date submitted and we can just click now. And we can fill in the patient eligibility. So we're going to complete one form for each infant. And again, the birthing parent needs to meet these criteria: admitted for live birth and screened positive for substance use during pregnancy using a validated tool, or is currently using MOUD. We'll capture these. This is the new form for those of you who are new to entering data for Dyadic. Is basically what's exciting about it is you're also entering information about the infant's care. And in the data dashboard, you'll be able to see data about both maternal care and infant care and how those relate to one another. So this could be a different person at your hospital who's entering the infant data, or it could be the same individual. But basically, that's what this is. We've got infant birth rate, infant sex. Was the baby born in your hospital, or was baby transferred from another facility? In what locations did the infant receive care during hospitalization? If you select other, a box comes up where you can fill that in. Infant testing. Was toxicology testing performed on the infant? Did the infant receive pharmacologic agents for neonatal opioid withdrawal syndrome? Was the infant eligible to receive his or her mother's own milk? Did the infant receive his or her mother's own milk? What type of feeding was this infant receiving at discharge or transfer from your hospital? And you can select all that apply. Was the infant discharged to home from your hospital or from another hospital? If you select your hospital or another hospital, there's some follow-up questions about that discharge. So was the eventual discharge disposition from hospital? What was that? Home with biologic parent, home with guardian or foster parent, other, unable to determine. What day of life was final discharge? Was the infant's length of stay affected by another diagnosis? If you select yes, you can list what that was. Was referral to early intervention made prior to discharge? Was verbal handoff sign out given to the outpatient primary pediatric provider? You can enter notes here. Again, being cautious not to include any identifying or HIPAA protected information. And then just a reminder that we need a separate form for each patient. So each infant will have a separate form. If this is complete, we can indicate that it's complete just for our own tracking purposes. This is not used by CPCQC, but can help hospital staff stay organized around which records were complete or not, and we can save and exit the form. Again, we're going to get a warning about some fields we didn't actually fill in, and best practice would definitely be to say okay and come back and make sure that we enter these missing fields. So that is how you will enter your data for chosen dyadic.